Morning, everybody, and welcome to our July 2019 Stakeholder webinar. My name is Belinda Bolton, and I am the Community Affairs Liaison for CPS, and I'm happy that everyone could join us today. Today's webinar is going to focus on a DFPS legislative update, and our presenters are Christine Blackstone, Associate Commissioner for CPS, Rand Harris, DFPS Chief of Staff, Rachel Nicholson, DFPS Director of External Relations, and David Kinsey, DFPS Chief Financial Officer. So thank you all very much for being here with us today. Before I turn it over to them, I want to just go over a couple of ground rules for the webinar. You can submit questions during today's webinar via the question tab on your control panel, and time permitting, we will do our best to answer as many of them as we can today. If you have questions after the webinar or we don't have time to get to all of your questions, you can email them to me at belinda.bolton@dfps.state.tx.us, and I will help you find answers to those questions. We also archive this webinar on our DFPS website for those who aren't able to participate today or for those who would like to go and refer to it later. So at this time, I'm going to turn the program over to Christine, Rand, Rachel, and David, and thank you so much for being with us today.
All right. Good morning, everyone. We're going to start off here with a high-level overview from our Chief of Staff, Rand Harris.
Good morning, everybody. This is Rand. We've been asked to come up here and talk about the 86th legislative session. You know, it's a good time to actually kind of reflect back on what took place. The dust has settled, really. We have a pretty good idea of, well, we do know what bills passed, what bills didn't pass, and where we are set with the budget. We're past the signing deadline for the governor, so we're ready to roll, and we're in the process now of going through bills and putting together implementation plans to move forward. So we're off and running beginning the next fiscal year, which is September 1. And you can see on the slide the number of bills that were filed both in the House and Senate and those that were tracked by DFPS. And it's really not that out of line with what transpired in the 85th legislature. I think there was maybe a few hundred more bills filed in the legislature this time around than last time. But bills affecting us, and I don't have the number exactly from the 85th, but I think we're fairly close to what we did last time. I would say, though, the big difference between the 86th legislature and the 85th legislature is kind of the size and the complexity of the bills, right? If you recall, in the 85th legislature, we really had some transformative bills. And it's not to say that the 86th didn't have transformative bills, but, you know, in the 85th, they were really kind of changed the, particularly in CPS, kind of the child welfare system, the way we approach what we do. And so I think the 86, these were much more manageable bills, if you will. Now, of course, we'll see how that plays out as we go through the implementation process, but I think they're going to be more manageable. And we did have a series of bills that were fairly large, and I think we're going to go through those in a minute. But I think any discussion about a legislative session and the impact it has on the agency or any programs really should start with what happened in the appropriations process. And so David's going to talk a little bit about what transpired in House Bill 1 and our appropriations.
All right, thank you, Rand, and good morning, everyone. I do want to first give a little context on the appropriations bill. Overall, for the agency, for the two-year appropriation, we're at $4.4 billion, which is a 6.1% increase over the current biennium. So we think there was a significant investment to move things forward. If you were around last session, It's not the type of investment that we saw last session when CPS was an emergency item and there was around $500 million put into CPS, which made a huge difference in terms of the number of caseworkers, salaries, rates for providers, relative caregiver payments in multiple areas. This session we came back and we asked to keep that momentum in CPS and also to address other areas of the agency. So what you'll see here in the appropriations bill for DFPS for FY 20 and 21 is a commitment to multiple areas across the agency. The first one you'll see is adult protective services, where we legislature appropriated salary increases for adult protective services and additional staff to reduce caseloads. The salary increases equate to approximately $750 a month for caseworkers and supervisors in APS.
And I think, David, going into the legislative session, when we had meetings with various members, I think there was a lot of momentum behind seeing this actually happen. I think for members downtown, they saw the success of what transpired in CPS when it came to turnover rates and caseloads and tenure. And so I think there was, eager is probably the inappropriate word, but there was definitely interest in looking at APS and statewide intake as well.
That's right, Rand. I think there was a strong interest and commitment to stabilizing the workforce in APS and statewide intake, similar to what was done in child protective services. And on that second point, on statewide intake, the frontline staff there will receive approximately $500 a month salary increase, which should go a long way towards improving retention, reducing turnover, and ensuring a tenured workforce. Another area that was a big commitment by the legislature this session was community-based care. The legislature put approximately $67 million into additional funding into community-based care in the next biennium to cover several areas. One is startup costs, network support costs, additional case management resources above what we transfer of our existing resources, our needs assessments, but also we got about $5 million for implementation and oversight as well. And what this will get, it will get community-based care in 5 areas of the state in stage 1, with 3 of those areas going to stage 2 over the course of the biennium. And I don't know if Christine or Rand or anybody wants to chime in on community-based care. This is a major commitment to Senate Bill 11 that passed last session to continue that expansion of community-based care.
Yeah, I think what we'll see is we currently are live in stage 1 in region 3B up in the Fort Worth area, in Bexar County, and in region 2, the Abilene-Wichita area. We are in startup phase in region 1, Lubbock, with St. Francis, and we have an RFA for stage 1 in the counties surrounding Bexar. So exactly as David said, this will allow us to do those 2 new stage 1 startups, as well as to move to stage 2 in the 3 existing areas. We anticipate beginning the startup for stage 2 in the 3B area during the fall. Some activities are already going on. And then progressively, as the year proceeds, in our other areas, as we and the contractors are ready for that.
And just I think a bit of commentary on my part. I think the success we see in community-based care in the 86th legislature is really somewhat of an outcome of a learning curve that took place over the previous session. You know, there was They're in the 85th and having a discussion about community-based care, and in the interim between the 85th and 86th, there was a lot of growth, if you will, and understanding about how the process works for the appropriators, for the LBB, and for members downtown. And so when the 86 rolled around, there was a better understanding of all the components of CBC, startup costs, network costs, CANS assessment, these other items, and which was hard for a lot of members last session to understand. So I really think everybody sees the interest in this and the opportunity for this. It was, I don't want to say ham-handed last time, it was just something new and something that the agency and members were working through together. This time I think it went much smoother, and I think you can see that in how it played out at the end of the 86.
All right, and on the next slide, we have rate increases. So this is another area where the legislature continued the commitment from the prior session. Last session, providers received close to $100 million for significant rate increases for foster care. This session, they came back and filled in some of the gaps for types of providers and types of placements that did not receive rate increases last time. And that this time covers emergency shelters, supervised independent living, and child placing agency support costs. In addition, in child protective services, we requested funding in several areas to support our caseworkers across the state and to provide additional staff or additional services where we wanted to target that to improve the system and the quality of care across the state. And we did receive client service staff, 30 staff to cover eligibility workers, human service technicians, and local permanency specialists. In addition, we received 10 preparation for adult living specialists and 5 medical services well-being staff. And I can stop there if Christine wants to add more context.
So I will comment on the preparation for adult living specialists. This is these staff have a pretty big workload, and we really wanted to see that reduced so we can continue to provide meaningful support for youth as they age out of our system, or if they're just teenagers in our system. We know that not only, in addition to serving the youth that actually currently are in our custody, our PAL specialists are frequently serving an informal caseload of kids who have aged out of our system, those youth continue to seek support from either their caseworkers or PAL staff as they transition to adulthood. So we're really excited to have additional support for this part of our work. The medical services well-being staff, this is something we've added. Over the last couple of years, about the last year, we've spent more time trying to understand some of what's happening with the medical services that our children receive and making sure we provide caseworkers and caregivers, be that foster parents or kin caregivers or parents, the necessary support around meeting our kids' behavioral and health needs. And we already had a handful of these staff, but as we've increased our activities, we really wanted to shore up our ability to provide meaningful support. So we're super excited about those staff as well.
All right, and the next couple items, supervised independent living, case management services for children with complex needs who are living on their own. We received $1.8 million for that case management service, which we don't provide today, which will be a benefit to these children who have complex needs and help them stay living on their own. And the next area, we have $2.5 million for post-adoption, post-permanency residential treatment services. So this is for children with complex behavioral needs to provide residential care. And those slots will make a big difference with some of the most difficult children with the most difficult needs.
And that really keeps kids from re-entering the foster care system. So it's a support to families outside of our system.
Okay. And then shifting over from the Child Protective Services to the Child Protective Investigation side, we did receive additional support on the investigation side as well, and this comes in the form of additional staff. For residential child care investigations, screener staff, child safety specialists, and child protective investigation risk managers. And again, this is filling in and supporting our frontline investigators with additional staff to meet particular needs in the system, and particularly to strengthen the residential child care investigations. Next, we have prevention and early intervention. Again, this was an area that received significant increases in the 85th legislative session and continued some modest increases in the 86th to expand HOPES and nurse-family partnership. Lastly, on our list, there were some needs that the agency identified through the appropriations process where we needed to strengthen our operations, and we were pleased that the legislature addressed those in 3 critical areas listed here. One is contract oversight with 18 positions, legal representation, which had some salary increase and new positions, and also our data and system support staff. All of these will make a significant improvement in these areas and help us keep up with the demand at the agency in terms of the complexity of the work and the volume of the work that we see here at the agency. I think that covers it. You can see that, you know, there really wasn't any area of the agency that they did not attempt to address in some way. None of these, or most of these, were not fully funded at our requested level, but the appropriators did make every effort with the resources they had to address the needs that we identified.
And I think pretty much by any definition that we view the 86, particularly on the budget side, as a success. You might recall, you know, the 85th, the agency was an emergency item. A lot of interest was placed on the agency during that process, and I think many had a concern going into the 86th legislature that members downtown would kind of approach the agency as, well, we took care of that issue in the 85th, we can focus our attention on other items. And so I think we were pretty pleased with the amount of interest that the legislature spent on the agency this time around. And David's right, we surely weren't funded, all of our requests weren't funded, but you're right, David, they did look at each area of the agency and did put some money in. So I think we're pleased with what happened.
And I think, just to echo what Rand says, that everything that was done really builds on what was started in the 85th and helps us continue our forward progress as an agency, especially in CPS. So on this slide, you'll see an overview of the CPS-only bills. You'll see there are 38 House bills and 20 Senate bills. Some of these are things that we'll just inform our staff about. There may be changes to education system or some other system that will be things that we'll just be informing staff about. But 28 of those bills actually do have implementation plans that I just read the first drafts of them last night. So we're finalizing those, and as we talk about some of the key bills, I'll inform you a little bit about our approach to those bills. So first up is House Bill 53 by Representative Minyares. And this basically is looking at our transitional living service program. This is what we call preparation for adult living. It's a series of class and educational and experiential activities for our youth as they reach the age of 16. This has us looking at several key components, working with the Office of Consumer Credit and the State Securities Board to add activities and education around budgeting, understanding responsibilities as it associates to paying taxes, credit histories, credit theft, and how the importance of insurance. So these are all things. We've been looking with a group of stakeholders at the curriculum for PAL over the last couple of years. And so this is just another opportunity to update it, bring it forward into the 21st century and modernize it. I'll say there's a couple of other things in this that aren't on bullet points here, but they also have to do with civic engagement and the importance of voting and mental health. So all of these things we will be working with our contracted providers. We ourselves do not provide this service to our youth. We contract with youth serving entities around the state to do that. So we'll be working to modify the curriculum, to work with our contractors to insert that new curriculum into the process as we move forward on our fiscal year 2020 contracts here in September. Hospital 72 is really a Health and Human Services Commission bill to implement, but because it's so critical to the youth that we serve, we want to include it as a key bill. This bill is associated with the Medicaid benefits that our youth receive as they transition into a permanent placement from a temporary placement. So when youth are in our temporary managing conservatorship, they receive Star Health benefits. As they transition, previously in the past, the kids have fallen into a fee-for-service. As they transition to either a permanent relative placement or an adoptive placement, they have fallen into a fee-for-service benefit for a period of time while awaiting selection of the permanent plan from their caregiver. And what this will do is make that transition seamless so that they can go, they don't fall into fee-for-service, they go straight from the benefit they're receiving as foster children to their caregiver picking the health plan that they will receive. It will allow for better continuity of care for kids and so improve health outcomes. We've already been meeting with our partners at HHSC to discuss the implementation that's needed. We think we may have some IT changes, but for the most part, on our part, it will be education and IT, maybe we share a data file with HHSC, and it may be some changes to that, but primarily it will just be educating our caseworkers, our adoption workers, the provider community on these changes and what our children and their families and caregivers can expect.
All right, what's next? 1884. Grace, we want to talk a little bit about this?
Sure. So House Bill 1884 by Representative Menjarez is something that we worked really closely with her office on this topic. She spent a lot of time talking with kinship caregivers particularly, and she really wanted to brainstorm on how to provide some additional resources to these families. And so ultimately she passed House Bill 1884 that really requires our caseworkers to do something that we think they're doing in practice today, but to really highlight the importance of kin caregivers partnering with child placing agencies, just so they have access to some additional supports and some services. It requires our caseworkers to remind them that they have that option. It requires the judges to remind them that they have that option. And you know, here in Texas, we've done a really good job, I think, of encouraging kin to come forward, and we think that kids get better outcomes through those types of placements. And so we're always excited to be at the table and try to improve the number of kids that get to spend time with kin, and however we can support those folks, we're there. So we're really grateful about this bill. And
I think this is a good example of building upon the successes of the 85th legislature. You might recall HB4 from the previous legislature was really kind of a paradigm shift for folks downtown. There's always been this interest, both inside the agency and outside the agency, to move children to be with relatives, to be with kin. And that sentiment is shared downtown. But with HB4, right? You really saw a change from the legislature in actually providing some sort of assistance to those relatives. This is building upon the success of HB4. You're right, Representative Menjarez, having been on Human Services in the past, had really taken a great interest in children and relatives, and the outcome of that was 1884.
And I'll just say one last thing. We've been growing the number of kin who are licensed foster parents from, in fiscal year 15, it was 753. In fiscal year 18, it's 867. So it's been growing, but maybe not at the rate that we would all like to see because of the benefits associated with it. And so this just really, as Rachel said, underscores that commitment to trying to encourage kin caregivers to benefit.
So I think next on our list, we've got House Bill 3390 by Representative Sanford. And this bill, if you've watched it, it's been, he's filed it for several sessions, and it really kind of stemmed from a personal experience that the representative had where, unfortunately, some children came into care and had some folks in their lives that probably could have been considered as kin caregivers, but weren't really contacted about that option. And so Representative Sanford has worked closely with the department for, gosh, at least 3 sessions now, trying to look at ways to make sure that we really can identify all possible kin or fictive kin, and how to encourage families to even remember who to help identify. And so ultimately, we landed on a bill that requires our caseworkers, attorneys ad litem, guardians ad litem, and all of the folks that really interact with a child that comes into care to continue to ask that child in a developmentally appropriate way, is there someone in your life that you think is a mentor or a friend or someone that you would rather be placed with instead of going into foster care? We have a good number of foster families that are wonderful, but again, this just goes back to highlight how important kin and fictive kin are in these kids' lives. And so we're really excited. We think this is another positive step forward. We're happy to be able to talk to kids about helping them identify good folks in their lives that would be safe and good placement options for them.
So Senate Bill 355 by Senator West. So actually this bill and the next bill, SB 71, among other things, begin to address some of the issues that are being discussed concerning the Families First Act. And for y'all out there who have been really following what's going on in child welfare, you know that that Families First will have an impact on child welfare as we see it moving forward. And the state, this state, along with other states, have a lot of decisions to make moving forward as we begin to implement the act. So 355 and 781 both speak in part to that. So on 355, you want to talk a little bit about
Sure.
that? Putting together a strategic plan on the prevention side of it. If you could talk a little bit about the difference between what our prevention, early intervention versus FFPSA.
Sure.
Sure.
So let's do a little background on the bill first. When 355 was filed, if you read the bill then, it really kind of conflated our prevention and early intervention here in Texas with the prevention services mentioned in the Family First Prevention Services Act. And the difference would be that our PEI program here in Texas is really front-end prevention before families ever interact with our child welfare system to try to help them not interact with our child welfare system. And the prevention services envisioned by FFPSA are really what we consider as FBSS services here in Texas. Perhaps there's some sort of issue that's brought you to our child welfare system, but we want to help keep you from entering foster care. And so we worked really closely with Senator West to kind of hone in on the more FBSS prevention services. And really what I think, if you've worked with Senator West at all, he's been very passionate about some of our prevention services here in Texas and wanting to help families stay out of the system. And so he wanted us to take that part of FFPSA and really come up with a strategic plan on how we would implement it, what those kinds of services look like, where they exist, what it would cost to purchase them. He became really kind of focused in on that. As the bill moved through the process, Chair Frank and the House saw a benefit to adding a similar provision for community-based care. He's been, you know, SB 11 requires a strategic plan for community-based care, and I think he wants to see that continued and developed. And I think he contemplated what community-based care would look like in an FFPSA world and how those two major programs would kind of work together. And so 355 tasks the agency with this kind of comprehensive strategic plan really for Texas. That's the way we're looking at it. These are all the pieces that are moving for our state, and how do they fit together? What can we prepare for? What's it going to cost? And where do we go next? So 355 really kind of lays that out for us, and that will be a major benefit, I think, to the 87th legislature to have a document and a plan on what decisions they need to make so that Texas can take advantage of some good federal opportunities, and maybe what the expected benefits or risks of those opportunities are going to be.
So this is probably, the 355 and 781 will be the bill that CPS will expend a lot of energy on during this session. These are really critical, forward-facing, future-facing bills that have us lay out the plan for child welfare in the state of Texas. So some of the activities that you can expect to see us engage in as it associates with 355, we are currently working with the rest of our partners here at DFPS, particularly our finance folks and our contracts folks, to develop an action plan for each component of what 355 calls for us to put in a strategic plan. So we'll have a list of all the activities that we will be engaging in as we move forward to deliver the report that will be due September 1st of 2020. Once we have those plans in place and the key parties responsible for, then we'll begin to engage in those activities. And of course, an important part of that is meeting with our stakeholders. And stakeholders can include the parents and youth that would receive these services, kin caregivers. There's a kin navigator component to Family First. It will include all of our service providers across the state, those who we contract with, those who HHSC contracts with, and those who are just out in communities serving folks. We recently did a poll across our regions to determine who all the state is using to provide parent coaching and parent training. That's not something we really purchase. That's something that we utilize community resources for. And we identified over 380 entities across the state of Texas who are providing parent coaching and parent training. And what we need to do now is figure out if any of those services that are being provided out there will fit under the framework of what the feds will pay for in Family First. So we actually have sent out several communications that some of you on this call may have seen about a survey that will be coming out tomorrow. So if you're a provider of substance abuse, mental health, or parenting services in the state, tomorrow you will receive a survey. It'll have a link. It takes about 15 minutes to fill out, so I strongly encourage you to fill out. There's some instructions on the email about who in your agency might be best situated to answer the type of questions that are in the survey. The survey will be out for about a month, and then we'll start, we're working with KC Family Programs and the Texas Alliance for Child and Family Services, and we'll start analyzing the information that we've gotten. In addition to that, we'll begin a series of stakeholder meetings out across the state with different groups, some with groups that are already well established and working in child welfare, community groups or parent advisory groups, or stakeholder groups like the Child Protection Roundtable. I'm meeting with a group of Texas CASA executive directors in October and start getting feedback on Family First. We also have a lot of work to do, some research to do, and some fiscal evaluation and analysis to do on what it will cost the state to move forward. The money from the feds is a 50% match, so we've got to figure out kind of where we go from there. So there's quite a number of activities that we'll be engaging in as it associates to 355 as we go forward.
Yeah, and I was just going to say, I strongly encourage you to take advantage of any opportunity you have to participate in either the survey or the focus group.
Yeah.
I don't want to jump ahead to 781, but I do think the agency is, not only are we excited to put together this kind of comprehensive strategic plan for Texas so the legislature can kind of weigh in, I think, you know, our 2-year or 6-month session every 2 years is kind of difficult when we have these major pieces of legislation that come down from the feds. And I know one of the things that we discussed with our oversight chairs and committees and members during session was the odd timing and how much information we're still gathering and waiting on when it comes to our federal partners. And so I think this is going to be a process. It's not a quick kind of one and done situation, but we learn more every day, and I think it will be a really useful tool for next session.
And I just want to mention one other key component of 355 is requires us to conduct a study and prepare a report evaluating whether we provide foster parents with adequate resources so that they can comply with all the regulations. We will be working with the Texas Foster Parent Association and Building Future Families, which is a foster parent advocacy group, to get some input from them on the types of things that we should be inquiring about with our foster parents as we prepare this study and report.
Okay, so continuing with Senate Bill 781. And so I think a lot of folks out there really kind of followed the genesis of this bill, right? From what was filed to what was ultimately enrolled, there was a significant change in growth on this. And I think, if you might recall, really the beginnings of this bill was to respond to some of the concerns that at least Chair Colcourse had concerning residential treatment centers. And so her office worked with our agency, with HHSC, with advocates to really look at what could be done to address some of the issues that have been raised concerning children in GROs and RTCs. And a lot of it really dealt with kind of the regulation side, if you will, over at HHSC. But even in the regulation side, you know, some of that impacts us as well. Can you talk a little bit about that part of it?
So, I mean, I think that some of the key components have to do with, you know, really ensuring that when RTCs get off the ground, that they have a quality start to providing services to our kiddos, and that, you know, as it associates with working with their communities and working with the education system in their communities in order to ensure that the day they open their doors, that our kids' needs are being met as in a meaningful way. We see, you know, working residential treatment centers, it's a challenging business. I think, you know, they are charged with caring for some of our kids who have some of the highest needs, and I think the bill just really sets out to ensure that as folks become licensed to be residential treatment providers, or as they are serving our kids going forward, that they have the support, that they have the plans and support in place to be successful. And so we feel like the components of the bill really will promote that. I think there's a couple other things in the bill as it associates to our runaway protocols. And we have been working for the last 2 years in particular at a really thorough, nuanced level out in the field with our youth, our caseworkers, our caregivers, to understand why kids run away, to understand what we can do to prevent runaways. We have implemented a number of internal practices across the state where there's a whole list of things that we do if a child does run, and that includes making sure they're on the National Missing Children's Registry, working with our local law enforcement, doing deep case dives to find addresses to figure out where kids might be, reaching out to everyone that we know that's associated with that child. And then on the back end, making sure that when we do find youth after they run, that we get in a room with them and anyone that's important to them and understand why they're running, what we can do differently to keep them in care and to keep them safe. I will say we've conducted several runaway operations in our big cities where we've partnered with law enforcement and our special investigators and our Child Protective Investigations Division to fan out and find youth. We've been very successful. Most of our youth, when we locate them, are in places that they've self-identified with family or friends that we may not have known about. And what we're trying to do when we find kids in those places is figure out if it's safe there, if it can be made to be safe there, and what we can do to support those youth so that if that's really where they want to be, they can stay there. We have found, I think this is an interesting note, that, like I said, most of these kids, that's where they are, and they don't report that they're being, for the most part, trafficked. We haven't, in our operations, found that to be the case, though, of course, we worry that the kids that we're not finding are those maybe in that situation. But so what the bill asks for us to develop trauma-informed protocols to reduce the number of runaways. Also, of course, we have to balance measures aimed at, our kids having normal lives, and sometimes that can be a challenge. But what we anticipate is a rulemaking process. We hope to leverage a lot of the work that we've already done into that rulemaking process.
And I just wanted to add to that there was a lot of discussion back and forth concerning how you balance that, right? And I think the office was very receptive to what we were saying. I think 781 reflects that.
Yeah, I think we don't want an overreaction to what's in the bill. We all think that we can achieve this, and we've actually been out with the Texas Network of Youth Services across the state with our provider community and our youth talking about this and what can be done to maintain that balance and make sure kids have normal lives, because one of the main reasons kids run is they don't like the rules that they're placed in, so it kind of gets to the heart of all of that need to balance for normalcy. And then also with the bill, you'll see the Family First strategic plan as it associates to congregate care. Family First calls for the reduction in the use of congregate care and for really targeted use of congregate care in specialized settings. And we will be doing the work the research and the evaluation and the analysis of what that would cost Texas and what benefits are associated and what opportunities the bill presents. So that will all be, we envision the strategic plan from 355 and 781 combined into a big document that really will be, along with all the components of community-based care that 355 has, that really will tie together the whole framework of child welfare. These are not separate things. We have to do them all at once, and we have to do them together, or do the components of each bill that the legislature wants us to move forward with. It's kind of a comprehensive effort.
So next we've got Senate Bill 195 by Senator Perry. There was some discussion last session about this idea as well, but this bill requires the agency to really collect some additional information on two things. One is children who were exposed to alcohol prior to their birth, and children who were exposed to substances prior to their birth. There's been a lot of discussion during this past interim and a lot of discussion nationally around the effect of substance abuse on the family and on children and states. And so I think this is not a surprise here. I think we will have to update impact to be able to collect this type of information, and definitely provide some training to our staff to make sure that we're collecting it in an accurate way. There is one little kind of funny factoid about this bill. The way it will need to be implemented is, as no funds were received for the bill, it will be implemented as we roll out impact modernization. And so part of our implementation process here will be determining when we can get those updates managed in our impact mod plan. And so more details to come on that, but I know the legislature is hungry to see some additional data, and so we will make that happen. And after that, the next slide is discussion around House Bill 883. That's the last of the CPS bills. There were a few little bills that affected APS, which is another one of our large programs, and this one particularly doesn't affect the program so much as it affects the population of folks that we serve through APS. A lot of our disabled or elderly folks face exploitation in a variety of ways, many of them financial, and so this kind of looks to get to the heart of when people defraud some of our folks via the internet. It increases the penalty for those types of perpetrators. And again, while this doesn't necessarily require any sort of agency implementation, we're glad to see there's some additional teeth to help protect some of our vulnerable citizens here in Texas. And then our last bill on the list is one that's important here to our agency and to all of our staff who dedicate their lives to working for our folks here in Texas. Senate Bill 1494 by Senator Paxton added our APS, CPS, and CPI caseworkers to the list of folks that are able to keep their home address confidential, so that information cannot be released by a local appraisal district. I will tell you, there are so many of our folks who get their vehicles damaged and are constantly harassed or accosted by, folks who have had a negative experience or are upset with the outcome of their case. And so we're always grateful to the legislature for helping us protect the folks that look to protect others each day. So just glad to see this additional protection passed by the legislature.
I wanted to go back. I forgot to say one thing that I really wanted to say as it regards to all of our work on Family First that we'll be doing going forward. The agency has on our website, there's a Family First page. You can sign up for updates. We'll be posting stuff. For example, I think after we finalize our action plan, we'll probably put that out. So that's just an opportunity to stay in the loop for if you're interested in the work that we're doing on Family First going forward.
Thank you all very much, the four of you, Christine, David, Rand, and Rachel, for a great presentation. We have a little bit of time to respond to some folks' questions, so I'm going to read them and then y'all can respond. So one of the first questions is the 6.1% increase in appropriations adjusted for inflation and population?
No, that's not adjusted. That's just taking the LBB numbers. If you look in the LBB documents for what they estimate for 18-19 expenditures compared to what's appropriated in 2021.
Thank you. Can you share more about the increased rate for supervised independent living?
Yes, I believe it's a 5% rate increase, and it's not listed in the appropriations bill specifically. SIL is one of the ones that's not in the rider, but we will be adopting rules to implement that rate effective September 1st, and if anyone's, following that rule process, you'll see the exact rates, but it should be a 5% increase effective September 1st.
Excellent. Thank you, David. What are the agency's plans for implementing House Bill 474?
I believe 474 was Representative Howard's bill, and I don't know that ever even got out of committee.
No, it was left pending in committee.
what was it for? Was it substitute care capacity, the capacity needs?
It was capacity needs, I think, for pregnant or parenting youth. And I think, and I'll defer to Christine if she wants, but I think that's a very difficult type of capacity to forecast. A lot of times, you know, we want to work with youth either if they become pregnant while they're in care to see if their current placement is an appropriate place for them. We definitely don't want to yank kids out of a placement just because something happens. We want to work with that family to make sure if that's a safe place that they've got the supports that they need. And oftentimes to work with youth who may be pregnant or parenting to either be placed with their child or even placed with kin. A lot of times, you know, we can wrap around a family to really make sure that they're getting the services that they need. So,
yeah, we have a small number of specialized placements for pregnant children, but I think Rachel's right. We prefer to see kids remain in the least restrictive environment possible. Most of our youth who are parenting have their child placed with them, so and it's just as difficult to forecast. But we don't typically struggle to place those kids. We're generally able to be successful in placing those kids.
Thank you. So I think this question is specific to the transitional living and preparation for adult living. Will there be any opportunities to engage youth?
Yes, we have youth councils all across the state, and we will be engaging them on all of it, you know, both in Family First, but in transitional living. As we make adjustments to curriculum, we use our regional youth councils. We also use our, those feed up into a statewide youth council that we utilize. We use them on a regular basis to get feedback on policy, on practice, on what's going on out there in the world with them. I just attended a youth conference in Denton with over 150 youth, spent the morning with them, hearing about their experience in foster care, what was important to them, and what was happening to them, with them, to them, how they feel things are going. So we regularly engage in youth. We anticipate that we will continue to do that on all fronts.
Excellent, thank you. Okay, one more question. Given that House Bill 18 requires school districts to implement trauma-informed care policies in their improvement plans, how will DSPS engage with TEA to ensure those policies align with appropriate trauma-informed care policies that will best fit the needs of foster youth and fulfill the requirements laid out in Senate Bill 781?
So I'll take a crack at it, and I'll let Christine correct me here if I'm wrong. So I think we're still kind of looking at House Bill 18. There's a couple of little components that definitely do affect our agency and determining how best to engage with other state agencies is appropriate. I will say that the Supreme Court of Texas here has convened a group to really look at trauma-informed care and look at what that kind of looks like implemented across our state, not just here in our child welfare system, but in other areas that would affect children and families as well. And so I imagine that the FCTIC will be really involved with helping to determine some appropriate trauma-informed protocols. When it comes to 781, DSPS has spent a lot of time during this past interim really looking at our trauma-informed curriculum, revamping that curriculum, and we think we're going to be able to have a really robust public training available on our website. And so when we discussed the need for schools to have access to some additional trauma-informed training with Chair Colkhorst and her staff, our plan is to make that new, robust, updated trauma-informed care training on our public website available to any school district that would want to utilize it. You know, we know teachers and school personnel already have quite a bit of training that they have to do, but we do think this is an important component, and we're excited to make that available. So,
excellent, thank you. So we had a clarifying question about a previous question, which was, can you ask about implementation for House Bill 475?
Yeah.
Instead of 474.
So 475 requires us to provide certain specific information to our youth that are parenting. We currently utilize a brochure that was developed some years ago to provide a number of different pieces and points of information to our youth who are pregnant or parenting. And this bill calls on us to add some additional components. I don't have it right in front of me, but as I recall, it includes safe sleep, and some other items.
Childproofing.
So all good, beneficial things that I think we should be informing our pregnant and youth about, and I hope that we already are. But I read the implementation plan last night, and I did have some questions for my staff. I think that while we can have caseworkers do that, I also think we want to look at the brochure that we already use, which is to reinforce in writing what the bill calls for. So we're still having some internal discussions about exactly how we'll implement, what that will look like, but I'll be happy to share that as we go forward. Yeah.
Great, thank you. So one more question. I think we have time for this last one. With the implementation of Senate Bill 195 by Perry, are there any plans for intervention with exposed children, perhaps related to CAPTA's plans of safe care, around the needs of family or caregiver in instances when an infant experiences withdrawal symptoms or fetal alcohol spectrum disorder, or is identified as affected by substance use?
I guess what I would say to that is we already do implement plans of safe care. We don't use that terminology here in Texas. It's kind of a phrase that I think at the time when it came out, folks felt would be a little confusing because we have the term safety plan here in Texas. But what we do to implement, but we are in compliance with plans of safe care, and what we do is just based on each child's individual circumstance when they're born drug exposed, we work with that family to identify the level and type of intervention needed to keep their child safe and to get the appropriate help and support to the parents in the home. And so we have a broad range of interventions that are available to us. Certainly we have 10 treatment centers across the state where women can be placed with their children. Is that capacity enough? When you're the biggest state of Texas and there's only 10, that doesn't allow women necessarily to do that in their own home communities. But we are currently working with HHSC. We have a work group associated with our interventions as they relate to substance use disorder to, kind of strengthen our response on plans of safe care. We feel comfortable that we have a range of interventions available to us, but just making sure that we leverage the opportunity for people to get those interventions in their own home communities is what we need to do now.
Excellent. Thank you all very much. That was lots of good information, so thank you. So this is going to conclude our webinar for today. Thank you all for participating, to everyone who is out there. If you haven't already, please remember to visit our website, dsps.state.tx.us, where you can sign up for news and alerts, which will include alerts about future webinars. And we'll also be able to, in a couple of days, this webinar, including the PowerPoint and the audio, will be archived on our DSPS website. And the easiest way to find that is to go to our website and in this little search box, type in Stakeholder Webinars, and it will take you to a page where you will find this and every other webinar we've done archived for your information. And so you can also share them from there. So thank you all again, Christine, Rand, Rachel, David. I appreciate you being with us today. And we will talk with y'all the next time. Thank you.